I don't know about changing the world, but I'm hoping that I'll change your views about certain things. I'm going to be talking about sex and why sex matters. Now, I think you all know that sex matters, but I'm going to be looking at it from a different point of view and in a way that I think is important for you to understand. For many years, actually, until fairly recently, we considered women pretty much little men, and men and women were essentially the same. We felt that their bones, their brain, their heart, their livers, all were the same, and that we could do research on men and extrapolate that to women, and we would get the answers that we needed to treat both men and women. Well, it's become apparent in the not too distant past that that's actually not accurate. We now know that the complex combination of genes, hormones, environmental factors, and physiology is in fact extraordinarily different for men and women. We also know that the prevalence, the susceptibility, the severity, and the time of onset of many conditions are very different for men and women. And we now know that a lot of the treatments, diagnosis, and tests that were formerly actually designed for men and used on women do not work, or don't work the same, or have different risk factors. Now, how did this all come about? In 1990, my organization, the Society for Women's Health Research, raised the question, how do we know if research that's been done predominantly on young, healthy white males could be extrapolated to women? Well, that was sort of, met with a fair amount of derision from the medical and research community, because research had been being done like that since the beginning of time, and nobody questioned it, and why were we? So we decided to go to Congress. So we went to Congress, and we asked the same question, and it turned out that there had been a Public Health Service report in 1985 that actually asked whether women were being included in clinical studies and whether sex differences was being noticed. And the answer, of course, was no. So we managed to have the policies changed at the NIH, at least in phase 3 trials, and we managed to have the policies changed at the FDA. But still, I don't know about you, but I've never seen a label on a pharmaceutical that made a distinction between men and women, except saying, if you're pregnant, don't take this. So we obviously still have a long way to go. What we did was, after we changed those policies, we commissioned a report at the Institute of Medicine, asking them to validate the concept of sex differences. And the result was, which came out in 2001, unequivocally that every cell has a sex, and that sex needs to be taken into consideration from womb to tomb. So we took that on the road. We went around to different scientific meetings and had our scientists give presentations on this, trying to get the research community understanding the importance of understanding the differences, and why understanding the differences was not just about women's health, but would help optimize health and health care for both men and women. And we did some other things as well. We formed 5 years ago the Organization for the Study of Sex Differences, which is an international organization for clinical and research scientists. As we speak, as we are here today, we are launching an online open access journal on biology of sex differences, so we can educate researchers around the world about why this is so important, and encourage them to come to our meetings, which will be held in the United States and around the world. And also, there is a similar organization being formed in Europe that we've been working closely with. So let me just give you a few quick examples. We know, with the rare exception of a couple of conditions that are only apply to men, like prostate cancer, testicular cancer, practically every other condition, whether it's osteoporosis, autoimmune disease, pain, cardiovascular disease, you name it, there are extreme differences in the prevalence of men and women. What we don't know is the why. And so while it's important to include women and minorities in clinical trials, it's only necessary to do that if you do the sex analysis. If you do not do the sex analysis, then just having them in the clinical trials doesn't give you the information that you need. So where are we going from here? Well, obviously, we're in Washington, so we do a lot of work with the NIH, the FDA, policymakers. We do a lot of medical education, work with researchers. We have our own research, interdisciplinary research networks in cardiovascular disease, musculoskeletal issues, neuroscience, and brain and behavior, as well as others. But here we are, it's almost 20 years since we started this, and what we don't have is out of only 2 of the scientific journals out of the top 10 even require that submissions and papers have note who the participants were in the trial, whether they were both men and women or just men, and whether there's sex analysis. Not one medical school currently has a required course on sex differences in this country, while in Europe they are now devising actually a curriculum, and we're trying to work with them, but it's going to be a whole lot more difficult here than apparently it is in Europe. And thirdly, we've been looking at the NIH and monitoring that for years now, and what we found most recently is 0.6% of the proposals granted, the grants that were submitted and funded by the NIH actually look at sex differences research. This is unacceptable. We need to know in an era of personalized medicine what those differences mean, what those sex differences mean in order to optimize health for both men and women. Thank you.